Dr. Matthew Budoff is a cardiologist at LA Biomed, located at Harbor, UCLA. He's currently doing research in early detection of heart disease, when it is most treatable, and even before the first heart attack occurs.
LA Biomed helps me in two ways. First, it provides me with a number of co-investigators, people who can help collaborate with my research, of varied expertise and varied backgrounds. Secondly, it provides a research environment that's really exceptional, giving me space for both my researchers and my lab, as well as providing me with equipment. My goal of my research is really to find early heart disease and to validate these tests to show in which populations they're most useful, when the test should be performed, and when and if the test should be repeated. So we've been doing this for 17 years now, and really I think we've been able to accomplish quite a bit so far. We've kind of validated a test called the heart scan, looking at early heart disease in both men and women, multiple ethnicities, as well as different groups of people, such as those with diabetes or kidney disease. It's really the work of my predecessor, who is here, Bruce Brundage, who started this and really came up with the concept of the mammogram of the heart, and we've just been kind of working on that in a global scale. Doing a lot of teaching here as well. We teach a lot of cardiologists and radiologists how to read these studies and then what to do with the information once they do it. So we have monthly training courses here where we get doctors from around the world to come in and undergo training. We have a test now that we can potentially apply to people who feel well, who have no symptoms, but we can identify early disease. And by identifying the disease early, when it's most treatable, we can impact it most greatly. So the idea would be you would take men or women at middle age and have them undergo this test. And if it came out abnormal, we would change their therapy. Test is very simple. Patients lie on their back, clothed the way they are. There's no IV, there's no needles, there's no injections, and in about 5 minutes they're done. We've taken a series of images of their heart, and we can take a look at it right away and tell them how their heart is doing.
We asked Dr. Budoff, what is the goal of the research?
So as a good example of this, President Clinton underwent 8 treadmill tests to look for heart disease, and all 8, while he was president, came out negative. Despite that, a couple of years after his presidency, he underwent bypass surgery, so clearly they missed disease on a number of occasions. Within months of President Clinton's bypass surgery, President Bush underwent a heart scan, the same test that we do here, and was found to have some early heart disease, and they started him on cholesterol therapy and other dietary changes. So even at the executive level, the executive physical now includes this test on an annual basis. The scope of heart disease in the U.S. currently is estimated at about 25 million Americans. So really maybe 1 in 10 people probably have some advanced form of heart disease right now, and the scope of this test would be much greater than that because we would find disease at a much earlier stage. So the estimates by the American Heart Association and the American College of Cardiology is that approximately 40% of adults should potentially undergo this test as a way of identifying their risk. So the scope is huge. I mean, probably in the hundreds of millions.